Now, rural and urban private hospitals are demanding the settlement of 29 billion shillings owed to them by the defunct National Health Insurance Fund, NHIF. Through their association, RUFA, the hospitals claim the lack of those funds have systemically affected service delivery in their health facilities across the country, while 75% of hospitals have not paid their workers for a period of 3 months now. And as NTV's Helen Aura reports, clinical officers once again took to the streets, protesting what they term as discrimination by the Social Health Authority.
2 months since the implementation of the Social Health Authority, and healthcare providers are now accusing the Ministry of Health of failure to reconcile NHIF debts as agreed in the Transition Committee report by 31st of December.
The Transition Committee report shows that NHIF owes, by 31st of August, NHIF owes healthcare providers 15.8 billion. That is by 31st of August in verified claims. But the same report says that 2.7 million claims are unverified. Now, from our own records as healthcare providers, we estimate that the liability of NHIF to providers was 29 billion. So 15.8 billion by NHIF's own admission, or share now, is clear money. For us as hospitals, there is a further 14 billion that needs to be reconciled.
According to RUPA, 67% of hospitals have defaulted on their overdraft facilities, a move that is slowly seeming unsustainable for them.
75% of hospitals have not paid their workers for the last 3 months. Another 25% of hospitals have a case in the small claims court. This is happening at the same point you are telling Kenyans, you are free to walk into any hospital and walk out. Healthcare is free. We need to be honest about the messaging. Unless the hospital's liabilities from NHIF are sorted, unless outpatient capitation at private healthcare, primary healthcare facilities is sorted, Kenyans will continue to experience out-of-pocket payment.
We must call this government to stop killing Kenyans.
This comes as clinical officers held demonstrations today in Nairobi County, lamenting over the lack of onboarding of over 1,000 health facilities into the SHA system. They are accusing the chair of the board, Abdi Mohammed, for discrimination.
You are going to perform a procedure that is going to cost a certain amount. And that amount, you must be allowed by that Social Health Authority for you to perform that procedure. Now they are saying you will not do it directly. What they want is that you have to go through an individual registered under a different body, which is the KMPDC, against the law.
Clinical officers say this will interrupt services in at least 60% of hospitals, a move that is likely to see Kenyans accessing healthcare stranded.
SHA kusema kweli watu wengi wajeridhishwa nayo kwa sababu wanasema NHIF haikuwa na shida yote. Kenye government ingefanya tu ni kufanya NHIF ikuwe more ikuwe inaweza kufanya kazi better than it was.
Ukijaribu kwenda kutafuta matibabu ukitumia SHA unapata bado mambo haijaenda vizuri. So ningeomba rais wetu hiyo mambo ya SHA itengenezwe mzuri.
Nilikuwa naomba hii serikali ambayo iko Kenya sasa na rais asaidie sisi kwa maoni kama hiyo. Kila kitu iende kwa ground, iende kwa community, iende kwa locations, iende kwa sub locations. Maendeleo itoke kwa sub locations sababu wale watu wanaumia au wale watu wanaungua au wale watu wako na shida ni wale wako sub locations.
The demonstrations are days shy away from the set countrywide doctors' demonstrations set for the 23rd of December this year. Helen Aura, NTV.